Good evening, everyone, and thank you for being here with me today. Before I say another word, I want you to do something for me. I want you to think back, right now, in your mind, to how you slept last night. Which side did you turn to? Did you toss and turn? Did you wake up with a heavy feeling in your chest, a strange tingling in your arm, a slight headache that faded by breakfast? Most of you will brush that off as just getting older. But as a doctor who has spent decades at the bedside of patients recovering from strokes, from blood clots, from heart attacks that came out of nowhere, I am here to tell you that something as simple, as free, as effortless as the position you sleep in every single night could be quietly working for you, or quietly working against you. And almost nobody has told you this. Not because it's a secret hidden away in some locked vault of medical knowledge, but because in the rush of modern medicine, in the 10-minute appointment slots, in the pressure to prescribe a pill and move to the next patient, this simple truth gets lost. Tonight, I want to give it back to you. I have stood in hospital rooms holding the hands of frightened patients who never saw it coming. A stroke doesn't ring a doorbell. A blood clot doesn't send you a text message warning you it's on its way. They arrive silently, often while the body is at its most vulnerable, and that vulnerable time, more often than any of us like to admit, is while we sleep. Think about it. For 6, 7, 8 hours a night, your body lies still. Your heart keeps beating, your blood keeps moving, your lungs keep breathing. But you are not there to notice if something starts to go wrong. You are not there to feel the first flutter of an irregular heartbeat. You are not there to notice blood pooling somewhere it shouldn't. Sleep is supposed to be restorative. But for so many seniors, sleep is also the most dangerous, unsupervised hours of their entire day. And the position your body rests in during those hours can either support the natural work your heart is trying to do, or make that work harder than it needs to be. Let me explain this in the simplest way I know how, the way I would explain it to my own mother, because that is exactly who I picture when I give this talk. Your heart is a pump. It is the most reliable pump you will ever own in your lifetime, beating roughly 100,000 times a day without you ever having to think about it. But like any pump, it works with gravity, with pressure, with the position of the pipes around it. When you lie flat on your back, or worse, on your right side, for extended periods, you change the angle at which blood returns to your heart. You change the pressure inside a very large, very important vein called the vena cava, the vein responsible for carrying blood from the lower half of your body back up to your heart. When that vein gets compressed, even partially, blood does not flow as freely as it should. And when blood does not flow freely, it has a tendency to do something we in medicine fear greatly: it pools. It slows down, and blood that slows down and pools is blood that is far more likely to clot. This is not some fringe theory. This is basic cardiovascular physiology that every medical student learns in their first year, yet it rarely makes its way into the conversations we have with our patients, especially our older patients, the very people who need to hear it the most. Why? Because as we age, our veins lose some of their elasticity. Our valves, those tiny one-way doors inside our veins that stop blood from flowing backward, become less efficient. Our blood itself, over the decades, tends to thicken slightly and clot more easily. This is simply a part of the aging process. Combine an aging circulatory system with a sleep position that works against gravity instead of with it, and you have created, quite literally, the perfect environment for a blood clot to form. And where do blood clots go? They do not politely stay where they started. They can travel. They can lodge in the lungs, causing what we call a pulmonary embolism, a medical emergency. They can travel toward the brain and contribute to a stroke. This is not fear-mongering. This is the honest, unfiltered truth of what happens inside the human body when circulation is compromised, night after night for years. Now, I want you to picture the position I am talking about, because words alone do not always paint the clearest picture. I am talking about sleeping on your left side, not your back, not your right side, not curled up so tightly that your knees touch your chin. Simply, gently, on your left side with a slight bend in your knees, ideally with a pillow supporting the space between your knees and another supporting your head and neck in a neutral position. This is a position that many cardiologists, many sleep specialists, And many physicians who specialize in circulatory health have quietly recommended to their patients for years. Why the left side specifically? Because it's simple anatomy. Your heart sits slightly left of center in your chest. When you lie on your left side, gravity assists the heart in doing its job. Blood from the lower body flows more easily back toward the heart. The vena cava is not compressed the way it can be when lying flat on the back or on the right side. Your lymphatic system, which I will explain more about in a moment, also drains more efficiently in this position. Everything, quite literally, flows downhill in the direction it is supposed to. I want to take a moment to talk about the lymphatic system, because most people have never even heard of it, let alone understand how deeply connected it is to heart health. Your lymphatic system is like a quiet, unsung partner to your circulatory system. It is responsible for draining excess fluid, toxins, and waste products from your tissues and returning that fluid back into your bloodstream. Unlike your heart, the lymphatic system does not have its own central pump. It relies on the movement of your body, the contraction of your muscles, and yes, even the position you sleep in, to move fluid along. There is a large lymphatic vessel called the thoracic duct, and it drains into a vein on the left side of your body. When you sleep on your left side, you are, in a very real physiological sense, giving your lymphatic system a helping hand, allowing it to drain more efficiently overnight. A well-functioning lymphatic system means less inflammation, less fluid buildup around the heart and lungs, and an overall reduced burden on your cardiovascular system. This is the kind of detail that rarely makes it into a mainstream conversation, but it is precisely the kind of detail that separates a truly informed patient from one who is simply told to take their medication and hope for the best. I have had patients, and I want to share this not to frighten you, but to humanize this conversation, who came into my office complaining of swelling in their ankles, a persistent feeling of heaviness in their legs, occasional shortness of breath when lying down at night. Many of them had already been told by well-meaning doctors that this was simply part of aging, or nothing to worry about. But when we looked deeper, when we considered how they were sleeping, what we often found was a pattern: years, sometimes decades, of sleeping flat on the back, or on the right side, night after night, silently placing a low-grade but constant strain on the heart and circulatory system. It was not the single cause of everything. I want to be honest with you. There is rarely a single cause for something as complex as heart disease or stroke. But it was a contributing factor, a piece of the puzzle that had been overlooked simply because nobody had ever brought it up. Let's talk about strokes specifically, because the title of tonight's discussion mentions stroke prevention, and I take that responsibility very seriously. A stroke, in the simplest terms, is what happens when blood flow to a part of the brain is interrupted. Either because a blood vessel is blocked, usually by a clot, or because a blood vessel ruptures. The brain is an incredibly hungry organ. It demands a constant, uninterrupted supply of oxygen-rich blood, and it does not tolerate interruption well. Even a few minutes without adequate blood flow can cause permanent damage. Now, most strokes that are caused by blood clots, what we call ischemic strokes, which make up the vast majority of all strokes, often originate from clots that form elsewhere in the body and travel to the brain. And where do many of these clots originate? In the deep veins of the legs, in a condition called deep vein thrombosis, or in the heart itself, particularly in patients with an irregular heartbeat known as atrial fibrillation. Anything that improves circulation, that reduces the likelihood of blood pooling and clotting in the extremities, that supports the heart in maintaining a steady, unstrained rhythm, is going to play a role, however modest, in reducing your overall risk. I want to be very clear and very honest with you, because I respect you far too much to stand here and tell you that changing your sleep position alone will prevent every stroke, cure every heart condition, or replace the medications your doctor has prescribed you. That would be irresponsible, and frankly, it would be a lie. Sleep position is one piece of a much larger picture that includes your blood pressure, your cholesterol levels, your blood sugar, your activity level, your diet, your stress levels, and yes, your genetics. But here is what I want you to understand: in medicine, we are constantly looking for what we call modifiable risk factors, the things within your control that can tip the scales, even slightly, in your favor. And sleep position is one of the most overlooked, cost-free, side-effect-free modifiable factors available to you. It requires no prescription, no co-pay, no trip to the pharmacy. It requires only awareness and a small adjustment to a habit you already engage in every single night of your life. Let me talk for a moment about why our right side and our back are, comparatively speaking, less favorable positions, especially for those of you managing existing heart conditions. When you sleep on your right side, the heart, being positioned toward the left side of the chest, can end up compressed to a small degree by the weight of the surrounding organs, particularly the liver, which sits on the right side of the body and is one of the larger organs we carry. Over time, and especially in people who already have an enlarged heart, congestive heart failure, or significant acid reflux, sleeping on the right side has been associated with increased symptoms and increased strain. Sleeping flat on the back presents a different problem. For many people, especially those carrying extra weight around the midsection, lying flat on the back can cause the tongue and soft tissues of the throat to fall backward, obstructing the airway. This is a major contributor to sleep apnea, a condition where breathing repeatedly stops and starts throughout the night. And sleep apnea, I want you to understand this clearly, is one of the strongest known risk factors for high blood pressure, irregular heart rhythms, heart attack, and yes, stroke. Every time your breathing stops during sleep apnea, your oxygen levels drop, your body releases a surge of stress hormones, your blood pressure spikes, and your heart is forced to work harder under more strain, night after night, for years, often without you or your doctor ever fully realizing the cumulative toll it is taking. So when we talk about left side sleeping, we are not talking about some obscure alternative medicine trend. We are talking about a position that reduces airway obstruction, reduces strain on major organs, supports healthy venous return to the heart, and assists the lymphatic system in doing its job. When you put all of these pieces together, you begin to see why so many physicians who specialize in cardiovascular and pulmonary health have quietly recommended this for years, even if it never made the evening news or trended on social media the way a new miracle drug might. I know some of you are sitting there thinking, "Doctor, I have slept on my back my entire life. I have slept on my right side since I was a child. How am I supposed to change this now?" And this is a fair, honest concern, and I want to address it with the same honesty I have used throughout this talk. Changing a lifelong sleep habit is not always easy, and I am not going to pretend it happens overnight for everyone. The body has memory. Your muscles, your joints, your sense of comfort have all been shaped over decades around a particular position. But the body is also remarkably adaptable, especially when given the right support. This is where small, practical tools make a tremendous difference. A body pillow, placed behind your back, can gently discourage you from rolling onto your back during the night without forcing your body into an uncomfortable or rigid position. A pillow between the knees relieves pressure on the hips and lower back, which often makes side sleeping far more comfortable than people expect. For those who find it difficult to stay on their left side specifically, even alternating between the left side and a semi-reclined position can offer meaningful benefit compared to consistently sleeping flat on the back or on the right side alone. I also want to speak directly to those of you who may be dealing with acid reflux, because this is an area where left side sleeping offers a benefit that extends beyond the heart alone. The stomach sits slightly to the left side of the body, and the junction where the esophagus meets the stomach is positioned in such a way that sleeping on the left side keeps that junction elevated above the level of stomach acid, making it far less likely for acid to travel backward up the esophagus during the night. This means fewer disruptions to your sleep, less nighttime coughing, less throat irritation, and importantly, better quality, more restorative sleep overall. And I cannot emphasize enough how deeply connected quality sleep is to heart health. Poor sleep, fragmented sleep, sleep interrupted repeatedly throughout the night, is itself an independent risk factor for high blood pressure, weight gain, insulin resistance, and increased inflammation throughout the body, all of which circle back and place additional strain on your cardiovascular system. It becomes a cycle. Poor sleep position leads to poor sleep quality leads to increased cardiovascular strain, and increased cardiovascular strain over years contributes to the very outcomes we are trying so hard to prevent. I want to share something with you that I have observed over many years of practice, something that I believe reflects a broader truth about how we approach health as we age. We tend to think of major health events, a stroke, a heart attack, a blood clot, as sudden, isolated incidents, something that simply happens to us, almost like being struck by lightning. But in the vast majority of cases, these events are not sudden at all. They are the final, visible chapter of a story that has been quietly writing itself for years, sometimes decades, through small, repeated patterns: the food we eat most days, the amount we move or don't move, the quality of the air we breathe, the way we manage stress, and yes, the position we sleep in for roughly a third of our entire lives. When you calculate it out, if you sleep an average of 7 to 8 hours a night, over the course of a single year, that adds up to well over 100 days spent unconscious, lying in one position or another. Over 10 years, that becomes years of cumulative time. Is it any wonder that something so consistent, so repeated, so prolonged, could have a meaningful cumulative impact on the body's most vital organ? I want to also address something that troubles me deeply as a physician, and that is how often this kind of information simply does not reach the people who need it the most. Our seniors. Younger generations have grown up with constant access to health information, wellness influencers, fitness trackers that monitor sleep patterns, apps that remind them to move, to hydrate, to breathe. But so many of our seniors were raised in an era where you saw the doctor when you were sick, took what was prescribed, and did not ask many questions beyond that. There is no shame in this. It was simply the culture of medicine at the time. But it has left an entire generation with gaps in preventative knowledge that younger generations now take for granted. This is precisely why I felt compelled to stand here and have this conversation with you tonight, in plain language, without unnecessary jargon, without rushing through it in a 10-minute appointment window. You deserve to understand your own body. You deserve to understand the small, practical steps that are entirely within your control. And you deserve for someone to sit with you, metaphorically speaking, and explain the why behind the advice, not just hand you an instruction and send you on your way. Now, I want to walk you through some practical guidance, because understanding the why is only half of the equation. You also need the how. If you are someone who has never slept on your side before, start gradually. Do not expect to transform your sleep habits in a single night. Begin by simply positioning a pillow at your back before you fall asleep, angled in a way that makes it slightly uncomfortable to roll fully onto your back without forcing your body into a rigid or painful position. As your body becomes accustomed to spending more time on your side, you can adjust the support as needed. Pay attention to your pillow height as well. A pillow that is too high or too low can create strain on the neck, which in turn can affect blood flow through the arteries in the neck that supply the brain. Your head, neck, and spine should remain in a relatively neutral, straight alignment when lying on your side, neither tilted too far up nor collapsed too far down. If you have shoulder pain, which is common among side sleepers, particularly those with arthritis or previous shoulder injuries, consider a slightly softer mattress topper or a pillow designed specifically to relieve shoulder pressure. Do not force yourself into discomfort in pursuit of a perfect position. The goal is consistency over years, not perfection over a single night. And a position that causes pain is a position you will abandon within days. Comfort and sustainability matter just as much as the physiological ideal. I also want to address something important for those of you who may already be living with a diagnosed heart condition, whether that is heart failure, atrial fibrillation, coronary artery disease, or a history of stroke. Please, and I cannot stress this enough, do not make any significant changes to your routine, including your sleep position, without discussing it with your own physician first. Every single person's cardiovascular situation is unique. Some patients with specific types of heart failure, for instance, are advised to sleep in a slightly elevated, semi-reclined position rather than fully on their side, because fluid accumulation patterns in advanced heart failure can behave differently than in a generally healthy heart. This is exactly why blanket advice, however well-intentioned, should never fully replace a personalized conversation with the doctor who knows your specific history, your specific test results, your specific medications. What I am offering you tonight is foundational knowledge, a starting point for a more informed conversation with your own care team, not a replacement for that relationship. I want to circle back now to something I touched on earlier, the idea of modifiable risk factors, because I think it deserves a deeper conversation. In medicine, we often categorize risk factors into two broad groups: those we cannot change, such as our age, our genetics, our family history, and those we can influence, at least to some degree, through our choices and habits. For decades, the conversation around modifiable risk factors has focused almost entirely on diet, exercise, smoking cessation, and blood pressure management. These remain, without question, the pillars of cardiovascular prevention, and nothing I say tonight should be interpreted as diminishing their importance. If you take nothing else from tonight's talk, please continue to prioritize a heart-healthy diet, rich in vegetables, whole grains, healthy fats, and lean proteins, while minimizing processed foods, excess sodium, and added sugars. Please continue to move your body regularly, even something as simple as a daily walk, because movement is one of the most powerful tools we have for supporting circulation, managing blood pressure, and maintaining a healthy weight. Please continue to monitor your blood pressure regularly, because hypertension remains one of the single greatest risk factors for both heart disease and stroke, and it very often produces no symptoms at all until damage has already occurred. Please continue taking any medications exactly as prescribed by your physician, and never adjust or discontinue a medication without medical guidance, no matter how well you may be feeling. But alongside these well-established pillars, I want sleep position to be added to your mental checklist, not as a replacement for anything, but as an addition, a supplementary layer of protection that costs you nothing, requires no prescription, and carries essentially no risk when done sensibly. In medicine, we often talk about the concept of stacking small advantages. No single small change is likely to dramatically transform your health on its own. But when you stack several small, sensible changes together, better sleep position, a slightly improved diet, a daily walk, consistent blood pressure monitoring, adequate hydration, the cumulative effect over months and years can be substantial. This is the honest, unglamorous truth about prevention. It is rarely one dramatic action. It is the quiet accumulation of many small, consistent choices, repeated day after day, night after night. I also want to speak briefly about hydration, because it connects directly to everything we have discussed about blood viscosity and clot formation. When the body becomes even mildly dehydrated, which happens quite easily in older adults whose sense of thirst naturally diminishes with age, the blood itself becomes thicker, more concentrated, and more prone to clotting. This is particularly relevant overnight, during those long hours without fluid intake. Ensuring you are adequately hydrated throughout the day, and having a small glass of water available before bed and immediately upon waking, can meaningfully support healthy blood viscosity and complement the circulatory benefits of proper sleep positioning. I often tell my patients to think of their circulatory system the way you might think of a river. A river that is well fed with water flows smoothly, carries debris along without it settling, and maintains a healthy current. A river running low on water becomes sluggish, allows sediment to settle and accumulate, and can develop blockages. Your blood, in many ways, behaves similarly. I want to take a moment now to speak about stress, because I believe it is often the most underestimated contributor to cardiovascular strain, particularly among seniors who may be managing grief, isolation, financial worry, or the loss of independence that can come with age. Chronic stress triggers a sustained release of stress hormones like cortisol and adrenaline, which in turn elevate blood pressure, increase heart rate, and promote inflammation throughout the blood vessels. Over time, this creates an environment within the body that is far more conducive to clot formation and arterial damage. If sleep is where the body is meant to recover from the stresses of the day, then a restless, poorly positioned, frequently interrupted sleep robs the body of its primary opportunity to reset and repair. This is yet another reason why prioritizing both the quality and the position of your sleep is not a small, cosmetic adjustment, but a meaningful contribution to your body's ability to manage the cumulative stress of daily life. I want to also gently address a myth that I encounter frequently in my practice, which is the belief that once someone reaches a certain age, meaningful change is simply no longer possible or worthwhile. I want to directly and firmly push back against this belief. The human body at any age retains a remarkable capacity for adaptation and improvement. I have seen patients in their 70s, 80s, and even 90s make meaningful improvements to their circulatory health, their blood pressure control, and their overall quality of life through consistent, modest lifestyle adjustments. Age is not a wall that stops progress. It is simply a factor that may require a bit more patience, a bit more gentleness, and a bit more consistency in how changes are introduced. You are never too old to give your heart a little extra support. Let me also take a moment to address the emotional weight that conversations about stroke and heart disease often carry, because I recognize that for many of you listening tonight, these are not abstract medical concepts. Perhaps you have lost a spouse, a sibling, a close friend to a stroke or a heart attack. Perhaps you yourself have already experienced one of these events and are living with the daily reality of recovery, of medication schedules, of physical therapy, of a body that feels different than it once did. I do not want tonight's conversation to add fear on top of what may already be a heavy emotional burden. My intention is the opposite. I want this information to serve as a source of empowerment, a reminder that even after a diagnosis, even in the aftermath of a frightening health event, there remain small, meaningful actions within your control that can support your ongoing recovery and reduce the likelihood of a future event. Knowledge, when delivered with honesty and compassion, should never be a source of fear. It should be a source of agency. I want to return, one more time, to the practical heart of tonight's message, because I believe repetition, when it comes to health information, is not redundant but necessary. So much of what we hear in a single conversation fades within days if it is not reinforced. So let me say it plainly one more time, in the clearest terms I can offer. Sleeping on your left side with proper support for your knees, hips, neck and head assists your heart in circulating blood more efficiently by working with gravity rather than against it. It reduces compression on the vena cava, supports healthy lymphatic drainage, reduces the likelihood of airway obstruction associated with sleep apnea, and may reduce nighttime acid reflux, all of which contribute, in small but meaningful ways, to a reduced burden on your cardiovascular system over time. This is not a miracle cure. It is not a replacement for medication, for medical supervision, or for the fundamental pillars of heart health that include diet, exercise, and blood pressure management. But it is a free, accessible, low-risk adjustment that too few people, especially too few seniors, have ever been told about in a clear, direct, and compassionate way. As I bring tonight's conversation to a close, I want to leave you with a simple thought to carry with you as you go about the rest of your evening, and as you prepare for bed tonight. Your body has been working for you, faithfully, every single day and every single night, for however many decades you have been alive. It has adapted, it has healed, it has kept beating through joy and through hardship, largely without asking anything of you beyond basic care. Tonight, I am simply asking you to return a small piece of that care in the most literal sense. In the position you choose to rest in tonight, and every night moving forward, it costs nothing. It requires no appointment, no prescription, no waiting room. It requires only awareness, a small pillow, and a willingness to give your heart the gentle assistance it has quietly been asking for all along. I want to thank you, sincerely, for spending this time with me tonight, for listening with the attention and patience that this topic deserves. I know health conversations can sometimes feel overwhelming, filled with unfamiliar terms and abstract concepts, but my hope is that tonight's discussion felt less like a lecture and more like a conversation between a doctor and someone he genuinely cares about. Because that is exactly how I intended it. Take this information, share it with your spouse, your friends, your neighbors, the people you sit with at church or at the community center. Because so many of the people around you are carrying the exact same lack of awareness that we addressed tonight, and a simple conversation, a simple shared piece of knowledge, could genuinely make a difference in someone's life. Before you go tonight, and before you settle in for what I hope will be a more supported, more heart-conscious night of rest, I want to ask one small favor of you. If tonight's conversation gave you something new to think about, something you plan to try, or something you plan to share with someone you love, please take a moment to subscribe to this channel. It helps this kind of honest, practical medical information reach more people, especially more seniors, who may never otherwise hear it. And please, leave a comment below. Tell me how you currently sleep. Tell me if you plan to make any changes. Tell me if you have questions about your own specific situation, or simply share this message with someone in the comments who you think needs to hear it tonight. Every comment, every share, every subscription helps carry this message a little further to someone who may desperately need to hear exactly what we discussed today. Thank you again, from the bottom of my heart, quite literally, for being here tonight. Take care of yourselves, take care of each other, and I will see you again very soon.